wanted to thank everyone for gathering here today as I accept my new position as the Executive Director of Patient Safety for the state of Pennsylvania. Those who know me both personally and professionally know that my passion for patient safety started very early in my career as a nursing student. It has been 20 years since the first year I spoke up for a patient that couldn't speak for themselves, and I haven't stopped. Every day in healthcare, there is an opportunity for improvement in patient safety. It can be difficult to speak up to a colleague, but in order to report and analyze errors, we need to speak up for the patients that cannot speak for themselves. My first opportunity for patient safety improvement occurred during nursing school. I witnessed a medical error happening during surgery and had the courage to speak up for the patient that couldn't speak for herself. It was that moment that I decided I wanted to make patient safety my focus. As a bedside nurse, patient safety remained at the forefront of my practice, whether it was advocating for double-checking high-risk medications or preventing the spread of multi-drug resistant organisms through enforcing gowning and hand washing. I also advocated for checklists to prevent medical errors surrounding the time before and after procedures. I have allocated grant money for patients to have flash drives of past medical history and medication lists to help make hospital admissions seamless even when traveling. My goals for the patients of Pennsylvania are to increase patient safety through the use of mandated checklists both pre and post procedures, to make continuing education available to medical staff at low or no cost, and lastly, to give patients a voice through the increased cognizance of the opportunity to speak up to prevent and report all errors at all levels of healthcare. The use of checklists have been proven to decrease medical errors because routine procedures become all too routine. Human nature causes us to lack attention to detail when the same task is repeated. Having checklists in place pre and post procedure helps the mind to focus on the tasks and equipment needed to start and end a procedure. I look forward to working with the Joint Commission on this project. Continuing education also has been shown to decrease the number and severity of medical errors. When I ask colleagues why they do not continue to educate themselves, cost is the biggest factor. I look forward to working towards making continuing education low or no cost as an option for Pennsylvania healthcare workers. Many errors go unreported because professionals are afraid to report themselves or their colleague. I want to increase awareness of the importance of reporting so that the event can be reviewed and have a root cause analysis. Finding out why an error occurred can prevent it from happening repeatedly. I'm excited to start my new role as Executive Director of Patient Safety for the state of Pennsylvania here in my home state. I look forward to working with healthcare systems to improve reporting of errors, improving access to continuing education, and making checklist systems for the moments surrounding procedures safer for patients. Please know that I will be advocating for all patients, and my office door is always open. Thank you.